Did you know that the very arteries keeping you alive right now could be silently narrowing while you sleep? Your blood vessels may be thickening, stiffening, and slowly losing the ability to deliver life-giving oxygen to your heart, your brain, and your legs. Statistics from leading cardiovascular institutes reveal that more than half of all adults over 60 have some degree of arterial buildup, and most of them have absolutely no idea. No warning, no obvious symptoms, just a quiet, invisible process beneath the surface of your skin. But here is the hopeful truth. What you put on your plate has extraordinary power to fight back. Today, you are going to learn exactly what to eat. Before we go any further, this information is grounded in real science. Multiple peer-reviewed studies published in respected cardiovascular and nutrition journals confirm that specific natural compounds found in certain fruits can measurably improve blood vessel health. We are talking about research from university hospitals, clinical nutrition trials, and decades of cardiology observation, all pointing to the same powerful conclusion. This is not folklore. This is not guesswork. This is evidence-based nutrition that your blood vessels are waiting for you to discover. And for people over 60, this knowledge may be among the most important you will ever receive. Here is what nobody tells you enough about getting older. After 60, your body undergoes a silent but significant biological shift inside your blood vessels. Think of your arteries like garden hoses. When they are young and healthy, they are flexible, smooth, and wide open. Blood flows freely. Oxygen reaches every cell. Your heart does not have to work hard. But as the years pass, something begins to change. Your body starts producing less of a critical molecule called nitric oxide, the natural compound responsible for keeping your artery walls relaxed and open. Research shows that after 60, this production can decline significantly, leaving vessels stiffer and narrower than before. And it does not stop there. Cholesterol particles, specifically the oxidized version of LDL, the so-called bad cholesterol, begin to burrow into the inner lining of your artery walls. This triggers inflammation. Your immune system responds. White blood cells rush to the damaged area. A hardened deposit forms. Doctors call it plaque. This process is atherosclerosis, and according to the Mayo Clinic, it can affect arteries anywhere in your body, your heart, your brain, your legs, your kidneys. Atherosclerosis creeps forward silently over years until one day the artery narrows enough to cause real trouble: angina, a stroke, or a heart attack. Perhaps you have noticed some early signs already: legs that feel heavy after a short walk, hands and feet that stay cold longer than they used to, energy that feels mysteriously lower, a slight mental fogginess you cannot quite explain. These are not just signs of aging. They can be signs that your blood vessels are struggling to deliver what your body needs. Millions of people over 60 accept these feelings as unavoidable. They should not. That is exactly what today's video addresses. Now, before we reveal the top 5 fruits, please take a moment to click subscribe and hit that notification bell. Every week, this channel brings you research-backed health information designed specifically for people in their 60s and beyond. Drop a comment below and tell us, what country are you watching from? We have a wonderful, growing community of wellness seekers from all over the world, and we would love to hear from you today. Now, let us get into the list. Nutritional science has reached a remarkable consensus over the past several decades. Certain fruits contain concentrations of natural compounds so powerful that researchers have described their effects on blood vessels as genuinely therapeutic. These are not exotic, expensive superfoods. Most of them are sitting in grocery stores right now, available to virtually everyone. What makes them special is a combination of mechanisms working together inside your body. Antioxidants prevent the oxidation of cholesterol, stopping it from damaging artery walls in the first place. Polyphenols, a broad family of plant chemicals, reduce the inflammation that makes existing plaque grow and harden. Certain amino acids found in fruit trigger your body to produce more nitric oxide, relaxing blood vessels that have grown stiff with age. And soluble fiber works quietly in your digestive system, binding to cholesterol molecules and pulling them out of your body before they ever reach your arteries. You are not taking a pharmaceutical with a long list of side effects. You are not undergoing a procedure. You are eating fruit, whole, natural, nourishing food, and giving your body the raw materials it has been missing. Think of it like renovating an old highway. The crews come in with the right tools, clear the debris, widen the lanes, and resurface the road. These fruits are the renovation crew for your cardiovascular system, and the research behind them is genuinely impressive. Let us start with number 5. Number 5 on our list is the apple, and before you dismiss it as too ordinary, consider what is actually happening inside your body when you eat one. Apples contain a remarkable type of soluble fiber called pectin. Pectin works like a sponge inside your gut. As it passes through your digestive tract, it binds tightly to cholesterol and bile acids, preventing them from being reabsorbed into your bloodstream. Your liver then has to pull cholesterol from the blood to make new bile acids, which lowers your circulating LDL levels. A randomized controlled trial published in a peer-reviewed nutrition journal found that eating 2 apples per day was associated with meaningful reductions in total and LDL cholesterol in adults with mildly elevated cholesterol levels. The researchers attributed these effects primarily to the pectin content and the unique combination of polyphenols found in apple skin. What is particularly exciting is that these cholesterol-lowering benefits appear after just a few weeks of regular consumption, which means you do not have to wait months to start seeing real results. But apples offer more than just fiber. They are rich in a flavonoid called quercetin, which acts as a powerful anti-inflammatory agent inside blood vessel walls. Quercetin inhibits the oxidation of LDL cholesterol. Remember, it is the oxidized form that does the real damage to your arteries. By neutralizing oxidative stress in the vessel lining, quercetin helps slow the process that allows plaque to form. Think of quercetin as a security guard posted at the gates of your artery walls. It identifies the troublemakers, oxidized cholesterol particles, and stops them before they can cause damage. Research published in cardiovascular nutrition journals indicates that regular apple consumption is associated with improved vascular function and lower levels of inflammatory markers in the blood. And the science on whole apples versus apple juice is unambiguous. Only whole fruit delivers the full package of fiber and polyphenols working together. Dorothy, a 65-year-old retired school teacher, had been dealing with mild hypertension for 3 years before she started paying closer attention to her daily diet. After adding 2 apples to her routine every day for 4 months, her follow-up blood tests showed a meaningful drop in her LDL numbers, and her doctor commented on her improved blood pressure readings. The biology does not lie. The combination of pectin, quercetin, and vitamin C in a whole apple, never juice, always the whole fruit, creates a synergy your blood vessels genuinely respond to. Coming in at number 4 is a fruit that surprises most people. Number 4 is grapes, particularly red and purple ones. And the key lies in a compound called resveratrol. Resveratrol is a polyphenol concentrated in grape skins, and over the past 2 decades, it has become one of the most intensely studied plant chemicals in cardiovascular science. Scientists became intrigued when populations consuming red wine cultures showed lower rates of heart disease despite higher fat diets. The answer, researchers found, was resveratrol. Research published in American Heart Association journals has shown that resveratrol evokes vasorelaxation and reduces endothelial dysfunction through the modulation of nitric oxide metabolism. In plain language, resveratrol helps your blood vessel walls relax and function more efficiently by supporting the very nitric oxide pathways that decline as you age. That is a significant discovery, but resveratrol is just one part of the grape story. Red and purple grapes are loaded with flavonoids and other polyphenols that have been shown in multiple clinical studies to inhibit the oxidation of LDL cholesterol, the first critical step in plaque formation. A comprehensive review published in NIH-affiliated research databases found that grape polyphenols reduce atherosclerosis through several simultaneous mechanisms, including LDL oxidation inhibition, reduced arterial inflammation, and improved platelet behavior. Platelets are the tiny blood cells that can clump together inside damaged arteries and make blockages worse. Grape compounds make platelets less sticky, which directly reduces that clumping risk. And here is something most videos on this topic miss entirely. Grapes also contain catechins and oligomeric proanthocyanidins that act powerfully against vascular oxidative stress. Research from JAMA Internal Medicine, examining resveratrol levels in older community-dwelling adults, found associations between higher dietary intake of grape-derived polyphenols and more favorable cardiovascular outcomes. Always choose whole grapes over grape juice to preserve fiber content and avoid excess sugar. Raisins, in small amounts, retain many of the same polyphenols and are a convenient option for seniors on the go. Now, get ready. Number 3 is going to surprise a lot of people. Number 3 is watermelon, and this humble summer fruit contains one of the most powerful natural precursors to nitric oxide that science has identified in any whole food. That compound is called L-Citrulline. When you eat watermelon, your body absorbs the L-Citrulline and converts it first into L-arginine and then into nitric oxide. Think of it like a two-step ignition process. L-Citrulline is the key that starts the engine, and the engine it starts is vasodilation, the widening and relaxation of blood vessel walls. Research published in PMC and peer-reviewed nutrition journals confirms that watermelon-derived L-citrulline can improve vascular function, including measurable reductions in arterial stiffness and blood pressure. A study examining the dose-response effects of daily watermelon intake found significant improvements in ambulatory blood pressure measurements over a 4-week period. A review in Frontiers in Nutrition confirmed that both watermelon and L-citrulline supplementation reduce blood pressure in human trials and support improvements in arterial stiffness, directly relevant to seniors whose vessels have lost elasticity with age. Arterial stiffness is one of the strongest predictors of cardiovascular risk in older adults. Anything that measurably reduces stiffness protects you from heart attack and stroke simultaneously. What makes watermelon unique is how quickly it can work. Nitric oxide production can begin within hours of consumption. Imagine your blood vessels as a kinked garden hose, the water struggling to get through. Nitric oxide straightens that hose, and suddenly the flow is free and full again. A single 2-cup serving of fresh watermelon delivers a meaningful dose of L-citrulline. For best results, eat the flesh closest to the rind where citrulline concentration is highest. Always choose fresh whole watermelon over processed drinks with added sugars, which completely undermine the benefit. Richard, a 72-year-old former firefighter who had been managing high blood pressure for nearly a decade, started incorporating fresh watermelon into his diet every day for 6 weeks. At his next checkup, his doctor noted his blood pressure readings were the most consistent they had been in years. His cardiologist told him to keep doing whatever he was doing. Now, we are entering the truly elite tier. Number 2 is backed by more published human clinical trials than almost anything else in the produce aisle. Number 2 is blueberries, and by extension, the broader berry family, including strawberries, raspberries, and blackberries. The superstar compounds here are anthocyanins, the pigments that give these fruits their deep blue, red, and purple colors. Anthocyanins are a subclass of flavonoids, and their impact on blood vessel health has been documented in numerous high-quality clinical trials involving older adults. A landmark study published in the Journal of the Academy of Nutrition and Dietetics found that daily blueberry consumption reduced blood pressure and arterial stiffness in postmenopausal women with stage 1 hypertension. The researchers concluded that these effects were due, at least in part, to increased nitric oxide production triggered by the anthocyanins themselves. Here is why this matters so much for people over 60. Arterial stiffness and high blood pressure are among the most dangerous cardiovascular risk factors in older adults. They force the heart to work harder, reduce the brain's blood supply, and dramatically increase the risk of a major cardiac event. daily blueberry consumption directly targets both of these risk factors. Research from the University of Reading found that a 12-week course of daily blueberry consumption reduced blood pressure by a clinically meaningful margin in older participants. Improved endothelial function, the health and responsiveness of the cells lining your blood vessel walls, was observed consistently across multiple trials. This is significant because endothelial health is considered by cardiovascular researchers to be among the most important indicators of long-term vascular well-being. Anthocyanins also act as powerful anti-inflammatories inside arterial walls. A study published in peer-reviewed cardiovascular literature found that higher anthocyanin intake was associated with reduced risk of coronary artery disease and hypertension. Think of anthocyanins as a cleanup crew working the night shift inside your arteries. While you sleep, they neutralize free radicals, quiet inflammatory signals, and gently restore the flexibility that age has slowly taken from your vessel walls. Just 1 cup of fresh or frozen blueberries daily delivers a potent therapeutic dose. And here is something practical to know. Frozen blueberries retain every bit as much anthocyanin activity as fresh ones, which makes this an affordable, year-round solution. Berries are inexpensive, widely available, and pair beautifully with our #1 fruit, which stands in a category entirely of its own. #1 is pomegranate, and the science behind this ancient fruit's effect on blood vessels is nothing short of extraordinary. Pomegranate contains a unique class of polyphenols called Punicalagins. These are among the most potent antioxidants found anywhere in the plant kingdom, and what makes them remarkable for blood vessel health is not just that they fight oxidative stress. It is that they actively protect nitric oxide from breaking down too quickly in your bloodstream. Remember, nitric oxide is the master molecule of vascular relaxation. After 60, you produce less of it. Pomegranate's punicalagins act like a protective shield around the nitric oxide your body does produce, extending its life and maximizing its effect. The clinical research on pomegranate and atherosclerosis is some of the most compelling in nutritional science. A study published in the American Journal of Clinical Nutrition found that pomegranate juice consumption reduced atherosclerotic lesion size by 44% in subjects with established plaque. A 3-year clinical study on patients with carotid artery stenosis, dangerous narrowing of the neck arteries leading to the brain, found that regular pomegranate juice consumption reduced carotid intima media thickness, which is a direct measure of plaque buildup. The same study found reduced LDL oxidation and a reduction in systolic blood pressure of 21% after just 1 year. A separate study published via PubMed found that 25% of subjects consuming pomegranate juice showed improvement in their atherosclerotic process, compared to only 5% who showed progression. These are landmark findings. Margaret, a 67-year-old retired nurse who had spent decades caring for cardiac patients, decided to follow the research herself. After drinking 4 ounces of pure, unsweetened pomegranate juice daily for 3 months, alongside her existing medical treatment, her follow-up cardiology appointment showed measurable improvements in her arterial health markers. Her cardiologist remarked that her vascular function had improved in a way he rarely sees without medication changes. Pomegranate is #1 because it attacks the problem from multiple directions simultaneously, protecting nitric oxide, fighting oxidative stress, reducing plaque, and lowering blood pressure all at once. No other single fruit does all of these things with this level of clinical evidence. Now, before you rush to the grocery store, there are critically important safety considerations you must understand. These fruits are powerful, and for most people, they are completely safe and highly beneficial. But there are specific situations requiring caution. Pomegranate and grapefruit can interact significantly with common medications. If you take statins, blood pressure medications, or blood thinners, these fruits, especially in juice form, may affect how your body processes those drugs. Please inform your doctor before adding large amounts of pomegranate or grapefruit juice to your routine. This is non-negotiable. If you have diabetes or prediabetes, be very cautious about any fruit juice. Juicing concentrates sugar and removes the fiber that slows glucose absorption. Always eat the whole fruit whenever possible. If you do drink juice, Dilute it 1 part juice to 2 or 3 parts water and limit consumption to early in the day when your metabolism is most active. Monitor your blood sugar response carefully, especially in the early weeks. People with a history of kidney stones should be careful with high oxalate fruits. Those with food allergies should introduce new fruits gradually. Pregnant or breastfeeding women should consult their healthcare provider before any significant dietary changes. And most importantly, these fruits complement your medical care. They do not replace it. Never reduce or stop prescribed medications without your doctor's explicit guidance. These fruits work beautifully alongside proper medical supervision, not instead of it. Now let us talk about how to put this into practice in a way that is sustainable and realistic. Start with whole fruits whenever possible. A whole apple, a bunch of whole grapes, a cup of fresh or frozen blueberries, slices of fresh watermelon, and the arils of a fresh pomegranate. If you opt for pomegranate juice, choose pure, unsweetened varieties and limit your serving to 4 to 6 ounces per day. Do not try to add all 5 fruits on the same day. Rotate them throughout your week so your body receives a diverse range of vascular protective compounds. A practical schedule might look like this. Start your morning with a cup of blueberries added to oatmeal or yogurt. Mid-morning, enjoy a fresh apple as your snack. At lunch, add a small cluster of red or purple grapes. In the afternoon, enjoy fresh watermelon. A few days per week, incorporate pomegranate arils into a salad or have a small glass of diluted pomegranate juice. Research suggests initial improvements in endothelial function and blood pressure can begin within 2 to 6 weeks. More significant changes in arterial stiffness or cholesterol typically require 8 to 12 weeks of consistency. Track your progress and share those results with your doctor. So let us bring this all together. You now know the 5 most research-supported fruits for cleaning and protecting your blood vessels after 60. Apples bring pectin and quercetin to lower cholesterol and fight oxidative stress. Grapes deliver resveratrol and flavonoids to protect your endothelial lining and slow plaque formation. Watermelon fuels nitric oxide production through L-Citrulline, relaxing and widening stiff arteries. Blueberries flood your blood vessels with anthocyanins, reducing arterial stiffness and blood pressure at the cellular level. And pomegranate, the undisputed champion, protects and amplifies your nitric oxide, actively fights existing plaque, and lowers blood pressure with some of the most compelling evidence in all of nutritional cardiology. These are not miracle cures, but they are genuinely powerful allies for your cardiovascular system, supported by real science, accessible to virtually everyone, and available at your local grocery store right now. The most important thing you can do is simply start. Pick 1 fruit from this list today. Add it to your next meal. Let consistency do the work that single grand gestures never can. Your body has an incredible capacity to heal and adapt, even after 60. Give it the right fuel and watch what it can do. If this video gave you even 1 piece of information you are going to use, type yes in the comments right now. Hit the like button, share this with someone you love over 60, and subscribe so you never miss a video. You deserve a long, vibrant, energetic life, and it starts with what you eat today.